Hello. Today we're going to discuss Chapter 8, Communication and the Nurse-Patient Relationship. This can be found in your textbook on page 101. In this presentation, I will introduce you to the topics related to communication and the nurse-patient relationship. Also, you'll be informed regarding the communication process, communication skills, therapeutic communication techniques, blocks to effective communication, interviewing skills, and communication within the healthcare team. Let's get started. In this section, 8.1, Communication Process, Techniques, and Barriers, we will cover the following objectives. Describe the component of communication process. List 3 factors that influence the way a person communicates. Compare effective communication techniques with blocks to communication. And describe the differences between a therapeutic nurse-patient relationship and a social relationship. The communication process. Let's define communication. Communication occurs when one person sends a message to another person who receives it, processes it, and indicates that the message has been interpreted. On page 102 in your textbook, there is a figure 8.1 which shows the communication process. The receiver must acknowledge that the message has been received and comprehended for communication to be completed. Good communication requires active listening, which means focusing on what is being said, timely feedback, which is the return of information and how it was interpreted, and thirdly, the validation of assumptions about nonverbal cues. By nature, communication is a continuous circular process that occurs in two ways: verbal, with words, or nonverbal, without words. Verbal communication must consist of words either spoken or written. Nonverbal communication, also known as body language, is conveyed by gesture, expression, body posture, intonations, and general appearances. What are some factors that would affect effective communication? Factors affecting communication can be culture, past experiences, emotions, mood, attitudes, perceptions of the individual, and self-concepts. All of these can contribute to a way a person is able to communicate. Cultural differences. As an LPN, prepare yourself to care for patients that do not speak or understand English. Facilities that accept federal funding, such as Medicaid, are legally required to provide language access to all patients. So what does this personal space mean? In the United States, 18 inches to 4 feet is the distance that individuals generally place between themselves and a new acquaintance. This is actually referred to as personal space. So when caring for individuals, please be mindful of the individual styles and needs, as everyone certainly are different and may not appreciate close contact. Eye contact. Most Americans expect direct eye contact when interacting with someone. Other cultures, for example, Japanese and Chinese, may consider it to be rude. So again, please be mindful of eye contact when caring for individuals of different cultures. Also be mindful of some words you may use and some things that we may consider as cultural norms or an individual's religious belief. Past experience and communication. All our experiences affect how we perceive communication. Interpretation of message is influenced by various things such as cultural values, education, things we are familiar with, occupation, and life experiences. Emotions, moods, and even the environment can drastically affect the way messages are sent or interpreted. A highly anxious person may not correctly hear what is being said or interpret the message differently than the sender intended. A depressed person tends to use few words A person who is upset or stressed may speak in a loud, harsh tone or be more abrupt than usual. Communication skills. Some people are naturally good and more effective at communication, right? Effective communication can, however, be learned by practicing and improving basic communication skills. So one important skill for effective communication is actually called active listening. So what is active listening? Active listening requires just that, requires great concentration and focused energy on what is being said. It uses all the senses to interpret verbal and nonverbal messages. Active listening entails actually listening for feelings as well as words. Maintain eye contact without staring and make a conscious effort to block out any distraction. Interpreting nonverbal messages. So what is this? This is actually the speaker's posture, gesture, tone, facial expressions, and eye movements which are being observed. A smile or frown, hunched down posture, and hand wringing are all expressed feelings. You as the nurse will gain skills in interpreting an individual's nonverbal message. Obtaining feedback. A vital part of communication is checking to see if you interpreted the message correctly. So how can you do this? You can do this by rephrasing the message or directly asking a feedback question such as, is your headache severe? Are you uncertain about having the surgery? Or does the idea of having anesthesia scare you? The response you receive should verify whether the original message sent was interpreted correctly. Focusing. Keeping the patient's attention focused on the communication task can save time. The effective communicator refocuses the other person gently to the issue when the focus has wandered. Adjusting styles. What does that mean? Just remember that every style of communication is different and that will vary depending on each patient. So consider the patient's style and level of usual communication when interacting. If the person is a slow, calm communicator, adjust to that pace. I know for some of us that may be hard. If a response is slow in coming, allow plenty of time for a response. Try not to display impatience. If it is comfortable for the patient to display feelings only in the context of telling a story about a related topic, allow enough time for a full development of the topic so that the feelings can be adequately expressed. Therapeutic communication techniques. This form of communication promotes understanding between the sender and the receiver. Various phrases or cues may be used to promote understanding or facilitate an interaction between you and your patient. These techniques should be used judiciously and in a varied manner, or the interaction will feel uncomfortable. In your textbook on page 105, table 8.1, you'll find a list of therapeutic communication techniques. Among that list are examples such as giving general leads, offering self, encouraging elaboration, giving information, looking at alternatives, and summarizing. Please take time to look at this table in your textbooks. Blocks to effective communication. Just as some phrases and cues encourage effective communication, just know that other phrases and cues tend to block or terminate interaction. In your textbook on page 109, table 8.3, this summarizes blocks to effective communication. See examples below. Okay, here we go. Question number 1. Please post your response in the chat box. Andy is having difficulty communicating with his patient. His patient barely understands English, is highly anxious about being hospitalized, and doesn't look at Andy when he is speaking. Which 4 factors affect communication? Number 1, cultural differences, past experiences, emotions, and attitude. Number 2, age, attitude, language, and tone of voice. 3, style, cultural differences, experience, and mood. Or is it 4, focusing, style, cultural differences, and past experiences? Please take a second to post your response in the chat box. Hope you all got this right. The answer is 1. The rationale. There are 4 factors that affect communication. They are cultural differences, past experiences, attitudes, emotion, and mood. Next question. Again, for this question, please post your response in the chat box. Holly is trying to encourage her patient to elaborate rather than replying in short 1 or 2 word answers. Her patient relates to Holly that she doesn't feel safe at home. Holly replies, "Would you tell me more about this?" This is an example of what type of therapeutic communication technique. Is this encouraging elaboration, restatement, open-ended question, or clarification? The correct response is 3. Open-ended questions create an inviting atmosphere for sharing thoughts, feelings, and concerns. Encouraging elaboration is, "I'm not certain that I followed what you mean." It is used to elicit further information about a topic. Restating is used to encourage the patient to continue with information on a topic. Seeking clarification is used to verify that the message heard is what the patient intended. Question 3. Again, post your response in the chat box. Marisol's patient is diabetic. Marisol notices her patient eating cheesecake, yum, and a cola from a visitor, and states to her patient, "I don't think that is a good thing for you to do, considering you have diabetes." This is an example of which block of communication? 1, changing the subject. 2, judgmental response. 3, defensive response. Or is it 4, giving advice? Think about this one. The correct response to number 3 is 2. The nurse is judging the patient's actions. It implies that the patient must take on the nurse's values, and it is demeaning to the patient. Okay, here we go. Our final question for this section. Emily's patient is very nervous about her surgery. She's having a breast biopsy. Emily tells her patient, "I'm sure it will turn out fine. You don't need to worry." This is an example of which communication block? Please post your response in the chat box. Is the response changing the subject, giving false reassurance, defensive response, or using cliches? Even though the nurse may have felt she was doing something correctly, her response was false reassurance. This kind of response negates the patient's feeling and may give false hope, which, if things turn out differently, can destroy trust in the nurse. Lesson 8.2, Communication Strategies for Specific Circumstances. The objectives covered here will be as follows. Discuss the importance of communication in the collaborative process. List 3 guidelines for effective communication with a physician by phone. Identify 4 ways to delegate effectively. Discuss 5 ways the computer is used for communication within the healthcare agency. And describe how communication skills can affect the quality and safety of patient care. Let's continue. Clinical practice. Use interviewing skills to obtain an admission history from a patient. interact therapeutically in a goal-directed situation with a patient, communicate effectively with a patient who has an impairment of communication, give an effective report to assigned patients to your team leader or charge nurse, be present and non-judgmental when communicating with patients, and be mindful of their needs. Challenges for nurses. Some challenges are as follows: developing interviewing skills, using the nurse-patient relationship, using empathy, becoming non-judgmental, maintaining hope, applying the nursing process, and communicating with hearing impaired patients, elderly, children, and people from other cultures. When a patient has a hearing impairment, determine how to interact with the patient to promote the best level of communication. If the patient has hearing aids, see that they are used, that the batteries are functioning, and that the device is turned on. A hearing aid does not guarantee that the individual will hear perfectly. The following techniques are examples to provide effective communication with patients who are hearing impaired. Speak very distinctly. Do not shout. Speak slowly. Get the person's attention. Maintain a good distance. Watch for nonverbal feedback. Use short sentences. And paraphrase for clarification. Communicating with an aphasic patient. The patient with aphasia, which is known as difficulties expressing or understanding language, will require specialized nursing interventions. Recruit the assistance of a speech therapist to determine methods to facilitate communication for these patients. A white erasable board is handy for aphasic patients who can write. Please refer to Figure 8.5 in your book on page 114 for an example of a communication board. Refer to box 8.1 on page 113 for specific techniques useful for communicating with patients who are aphasic. Communicating with older adults. Older adults vary greatly in their communication abilities, interests, and capabilities. Healthier older adults sometimes require more time to think and formulate a response. Assess for hearing deficits. Assess for visual deficits. Give time for elders to formulate responses. Wait for an answer to one question before asking another. And obtain feedback. Communication with children. When communicating with children, consider the influences of development on language and thought processes. Young children are very responsive to nonverbal messages. A young child may become frightened by sudden movements or gestures. Approach children at eye level and use a calm, quiet, friendly voice when interacting. Give simple explanations and demonstrations. Allow child to handle equipment. When communicating with people from other cultures, determine the language spoken. In some cultures, older adults are not accustomed to taking instructions from a young person. If necessary, obtain an interpreter. You may have to enlist the aid of a family member if appropriate. Give printed material if available and answer any questions. Again, be aware of cultural differences in regards to eye contact and personal space. Communicating with healthcare team members. Communication within the healthcare team occurs in a variety of ways. Via writing notes, reading nurses' notes, providers' notes, dietitian notes, and orders of the respiratory, physical, speech, occupational therapist, as well as listening to and giving a shift report. Shift reports is a verbal communication on the details of a patient's condition and treatment. Completing forms for the laboratory, radiology, and other departments is another method of communication. Telephoning primary care providers. In your role as a nurse, there will be many times you'll have to communicate to the primary care provider. Primary care providers may be telephoned from time to time, such as when orders may need to be cleared or clarified. The patient's condition may change. The patient may have a particular request, or you may need further information regarding the patient. If a primary care provider is called regarding a change in the patient's condition or any situation in which new orders are anticipated, certain steps should be followed before you conduct that phone call. Prepare yourself for the phone call when contacting the primary care provider. Have current data on the patient at hand, including data from the last vital signs assessment, pertinent laboratory information regarding the patient's eyes and nose, and any medication the patient may have received. Have the patient's work information sheet, medication record, and a pen ready, and anticipate the information that the primary care provider might need to make a decision. Prepare a concise problem statement and document the call and the physician's response. Assignment considerations and delegating. I've mentioned previously before in other classes that there may be times you have to delegate tasks to your nursing assistants. And what does that term delegate mean? Delegate means to authorize another person to do something. The definition for delegate can be found in your chapter 8 on page 115. Give clear, concise message and listen carefully to feedback. When delegating, include the results desired and the timeline for completion along with the task assignment. Ask the person to whom you are delegating if there are any questions about what is to be done, and ask for a summary of what is understood about the task to be done. Computer communication. So this day and age, many facilities are moving towards using computers to communicate patient information. The computer allows for the transmission of requests for laboratories, dietary, radiology, physical therapy, respiratory therapy, and other services. The primary care provider enters medication orders as well as additional orders via computers. Patient care is also used and updated via computers. Computerized patient information requires extra vigilance to safeguard confidentiality. Please keep this in mind when using computer technology. Communication in the home and community setting. Nurses who work in home care, as I've done, and which I love, often have both a professional and social relationship with their patients and families. Often, the nurse is the only person who sees a patient. Because of the social aspect of the visit, it is essential to state when instructions are about to be given so that the active listening can occur. In your textbook on page 117, there are tips for effective interviewing in the home care setting. Final question, question number 5. Please post your response in the chat box. Sarah has graduated from nursing school. She realizes that all of the following statements are true regarding communication except for which one? The ability to use a computer for communication is essential for today's nurses. When communicating with a child, you should speak loudly and maintain an even tone so that the child can hear you. Phrases that tend to block or terminate communication should be avoided. Giving an organized, efficient end-of-shift report is an important communication skill for nurses. The correct response is number 2. A child should be approached at eye level with a calm, quiet, friendly voice when communicating. Speaking loudly could scare a child. All the other statements are true. This concludes our presentation on Chapter 8, Communication in the Nurse-Patient Relationship. Thank you.